This is Dr. Sheenam Bansal. So today we will do Morel level lesion. So what is a Morel level lesion? It is also called the pseudocyst. Pseudocyst. It is also called degloving injury. It is also called expanding hematoma. So where does it occur? It mainly occurs in the acetabular fractures and in the pelvis fractures and in the your proximal femur fractures. Main sites are GT, lower back, knee, etc. Pathology is, see here, epidermis, dermis, subcutaneous fat is there, then deep fascia is there. In between the subcutaneous fat and deep fascia, there is lymphatics and vasculature. Due to their injury, there is collection of fluid here in between the subcutaneous fat and deep fascia. This fluid consists of blood, then your debris, necrotic debris. Okay, this fluid and lymph, etc. So, what happens with time? Blood get reabsorbed, and there is formation of pseudocapsule. Okay, so it is collection of fluid is occurring in between the subcutaneous fat and deep fascia due to the shearing forces. It happens in the due to the shearing injuries and high force injuries. Okay, injured lymphatics and vasculature is due to the injury of lymphatics and vasculature, there is collection of fluid. That is injury of subdermal plexus. Now symptoms are swelling, skin mobility increase, swelling is there, skin mobility is there, skin discoloration occurs after some time, not immediately. Paresthesia can also be there. Okay, now you will get done the x-rays. Why x-rays? To diagnose the underlying fractures. CT to calculate the size of the lesion, because size is very important to treat it. USG to like if we are doing the percutaneous drainage, you have to localize the lesion. So USG is for the localization of the lesion. MRI is the gold standard. Now in the acute cases, in the acute lesion, in the T1 you will see hypointense and the T2 hyperintense in the acute cases. Subacute cases T1 and T2 both are hyperintense and capsule is hypointense. Okay, pseudocapsule. Now treatment is non-operative if there is size less than 50. Then in the non-operative you have two options, compressive therapy and percutaneous drainage. Now see if in which cases we will do the open surgery. Open surgery can be done with the single incision if there is large lesion and lesion is not in the way of surgical approach, then you will use single lesion, otherwise dual incision if lesion is over the surgical approach of the fracture. Okay, so next you have option of sclerotherapy. You can have option of sclerotherapy also, surgical debridement also. If lesion is asymptomatic, then no treatment should be done. Okay, now you should be able to differentiate it from the abscess, contusion, bursitis, soft tissue tumors, etc. Okay, now complications are recurrence of the lesion is the most common. Pseudocyst can be formed, skin necrosis can occur, infections can occur. Infections in cases where the lesion is on above the surgical approach. In those cases, infection can occur, so we use the dual incision technique. So this is all about the Morel level lesion, which is very important for the examination purposes also.